Nebraska is due to her lifelong mission to provide evidence-based medicine to enhance the standard of care through surgical expertise, compassion for women's health, and emotional support. As an osteopathic surgeon, Dr. Jendro brings enhanced surgical training and vast experience from accredited medical institutions and is committed to her patients through their entire journey. I know this to be true because I work with her on a daily basis. Dr. Jendro was individually selected for a Breast Surgical Oncology Fellowship at H. Lee Moffitt Cancer Center and Research Institute in Tampa, Florida. As a Breast Surgical Oncology Fellow, Dr. Jendro studied under Dr. Charles Cox, a renowned pioneer in breast surgery. Her training focused on best surgical methods for treating both benign and malignant breast disease. Dr. Jendro is published in the Journal of Surgical Oncology as well. In addition to her extensive surgical training, Dr. Jendro operated as a breast surgical oncologist from 2013 to 2021 at UNC Rex Hospital. She served with distinction as chair of the UNC Rex Breast Care Committee. This committee, led by Dr. Jendro, was responsible for meeting national standards for the National Accreditation Program for Breast Centers and the Commission on Cancer. Her leadership as chair, coupled with collaborations with other oncology physicians, was essential in maintaining these esteemed credentials or accreditations at UNC Rex Hospital. Dr. Jendro was chosen to receive the 5-Star Excellence Award for scoring in the top 10% nationally for excellent responses in surgical services and overall quality of physician care. That's pretty amazing. At UNC, Dr. Jendro was an integral part in developing the Multidisciplinary Breast Conference, where patients are presented for collaborative discussions between surgeons, medical and radiation oncologists, radiologists, plastic surgeons, pathologists, genetic counselors, social workers, and clinical trials teams. Her contributions helped establish personalized, multidisciplinary treatment plans for patients to ensure the best outcome. Currently, Dr. Jendro has been honored with the distinction of Chief Medical Director of the Bryan Health Multidisciplinary Breast Tumor Board and the Bryan Breast Cancer Multidisciplinary Clinic at April Sampson Cancer Center. And it also now includes therapy. Isn't that great? So with all these credentials, she sounds amazing on paper, but I can attest that she's an even better human, and I really enjoy working with her. Please welcome Dr. Rachel Jendro. Actually hold the mic. I'm sorry about that. It doesn't extend up very tall. Kind of hold. There we go. Okay. Thank you. Wait for the bells. Very soothing. Lots of soothing sounds today, right? Yeah, so I'm from Kentucky originally. Much you could have heard college. And then medical school in Kentucky. My residency was in Ohio, so I spent 5 years in Ohio doing general surgery residency, and then over to Florida for my fellowship. And landed in North Carolina for a while, and I was there for 8 years, and just felt a calling to move to Nebraska. You guys have never been to Nebraska in my life. And they had a job opening, and they were building this amazing cancer center, and I was like, oh my gosh, this would be a great opportunity to come help build this program. So I brought my family here, and we interviewed, and that was it. They're like, all right, this is it. We're moving our lives and our kids to Nebraska. We've never even been here, and we love it. So we're very, very thankful to be here. My girls are 7 and 8, and they're doing great, and we
We love it here, so I'm thankful to get to be with you guys. So, everyone is touched by cancer in some way. We either know someone who's had it, we're taking care of someone who's had breast cancer, we ourselves have a current diagnosis, or we've lost someone. So we all in some way are touched by this disease. And according to the American Cancer Society, 40% of people in the United States will develop cancer. That's a huge number. That's almost 1 in 2. So it affects so many of us. So what is cancer? We talk about this word and this disease. What is it? So we are made up of trillions of cells that over our lifetime will grow and divide and go through their normal processes. And usually, when these cells become abnormal or there's a malfunction or they get old, then they should die. They should recirculate and those cells should die. So cancer is when something goes wrong with that process. So those cells don't die, or they're creating too many of those cells, and this overgrowth becomes a cancer and it starts to grow out of control. So then that's when this word cancer comes along. It can develop because a multiple variety of things, lifestyle, genetics, being exposed to different cancer-causing agents that I feel like we're learning more about now. And a lot of times, there's just no reason. We can't put a finger on it. We can't say, that's the reason. We just can't give a good reason for why it happened. Nobody wants to hear this word. It's a terrifying word. You have cancer. No one ever thinks that they'll hear that word or wants to hear that word. And so it's scary. We get very anxious. It's overwhelming. What are we going to do with this? And I hear all the time from my ladies, am I going to die? It's scary. So it's a super scary time. And then you start this journey of chaos and madness a lot of times. So you start information gathering. We're going to meet with lots of doctors, and it's hard to keep up with who you're meeting with and what they do and why are you seeing this person. And you might need another scan, you need a CT, you need an MRI, then maybe that leads to another biopsy, and you're just on this roller coaster. You're trying to get this plan together. A lot of times, I hear this every day, it's just moving so fast, I can't process this. I don't have time to kind of sit and think about what is this next step. You're just on to the next appointment, moving to the next thing. You don't a lot of times have time to kind of sit and check in with yourself and how am I doing, like mentally and physically, how am I coping with all of this that's coming at me? It can just be like a whirlwind, and a lot of times you just want to be, somebody wake me up and just say this is not real. This can't be real. It's never something you thought you'd be a part of or ever wanted to be a part of this club that we're in now. And you're really trying to tell yourself it's going to be okay. You're talking, all your family is scared. They can't fix it. They can't do anything about it to help you. And you're just trying to encourage them, it's going to be okay, we've got this. And maybe not knowing yourself, is it really okay? I'm not sure if we've got this or not. So as a breast surgical oncologist, I can speak to the breast cancer side. My complete focus in my practice is taking care of breast cancer patients and removing their cancer surgically. So that's my every day, and it is a calling, and I love my patients. I love you guys, you know this. So kind of what that journey can look like for breast cancer patients is they meet with the surgeon. We talk about different surgery options. They meet with medical oncology. We meet what kind of medicine are we going to need with this? And then radiation comes into play for a lot of folks. So it's just multiple different types of treatment that we've got to, first of all, understand what are all these words that you're saying. It's like a different language, trying to understand what all these words mean, and please explain this. In my practice, every patient needs a nurse navigator. So a lot of you have nurse navigators, and they are priceless. It's just this great mediator of someone you could always get a hold of. And if I'm in the OR and you can't get the medical oncologist, you can always get your nurse navigator. So it's just that little piece of, okay, I know I can talk to this person, and they're going to get an answer for me. So we always have that backup plan. Genetic counselors are in the picture for a lot of folks, and social workers too. My pictures are so much prettier than those red ones, by the way. Mine are pink. So, those first meetings are very overwhelming. How are we going to get through this? It can be just overload. So then you've got to decide, how am I going to deal with this? What do I want to do with this? And how do I want to go forward? And you and your provider should all be this should never be, this is your plan and this is what you're doing. This should be, these are options that you have, and how do you want to move through it, and how are you most comfortable doing that? So this should be a team effort here, not just something you're told you're gonna do. You should have a word in this plan too. You need providers that understand and sympathize with you. You don't need someone who is cold and disconnected and here's your treatment, see you later. You need that empathy, and you need someone to help you through this. It's life-changing, so your needs, your wants, what you need to get through this, all should be addressed and validated every step of the way. So with these treatments, you may be looking at surgery, chemotherapy, radiation, hormone blocking medications. There's a lot of different treatments that kind of play with cancer. And it seems to go pretty quick. So I have a lot of folks say, I haven't even had time to think about what I just did, and I'm on to this next thing. Like it just kind of comes at you pretty fast. You're just moving on. On the breast cancer side, a lot of times we do surgery, and then we wait 4 weeks and we start chemo, and then we wait 4 weeks and we start radiation, and then we wait a few weeks and we start something else. You're just always on to this next thing. And you're getting seen a lot. So if it's radiation, it's every day. You could be every week or every other week for chemo. It's something all the time that you're having to process. So then you get through all of this, and you've done all these things, and then they say, okay, we'll see you in 3 months. I'm like, wait, what do you mean? I've been seeing you every day. I've been seeing you every week, and so that can then bring on a whole new kind of, okay, so now what do I do? I'm not seeing you all the time. I'm not gonna see you next week, and you're gonna make sure I'm okay. How do I do that now? So that kind of brings on the next phase of, okay, how do I go back to life now? What does life look like now? What's just my daily, it kind of is this, the next phase of all this. And you're definitely not the same. You're not the same person as when you started. It's a huge journey. You're very different now after going through this. Mentally you changed, physically you changed. And you can tell other people about that, but nobody gets that but you, and maybe other folks who have gone through it, but everyone's journey is very different. So it's nobody gets it but you. So I'll see folks in the office and they'll tell me about something, and I say, that is your feeling, and you are valid in feeling that. Nobody should tell you otherwise. Like, you shouldn't feel that way, you're fine. Oh, this is fine, don't worry, but no, it's not fine, and it's how you feel, and it's okay to feel that way. So you should be valid in what you're feeling. So we've gone through all these doctor's appointments, we really focused on beating this cancer, and now we've got on the other side, and so now you're thinking about, was it gonna come back? Am I gonna have to deal with this again? How does my spouse look at me now? I had a double mastectomy. What does that look like now? How are the feelings? How are your kids doing? You've got little children and they're watching mom or dad go through cancer and losing your hair and getting sick, and how are your children processing all of this? And I've got to get back to work. I've got to provide for my family. How is that going? Am I handling this? It's a lot. It's a lot to go through. Some things that cancer folks go through: hair loss, neuropathy, limited range of motion from whatever surgery they had to have. You're still sore and tight, which is where a lot of therapy comes in. You're tired. You're just tired, man. It wears you out. It's exhausting going through all this. And a lot of folks think, well, you should be fine. You should be back to it. You get back to work. Well, no, it's exhausting. Your appetites change. You've got chemo brain. You knew you thought of something 5 seconds ago, and what was that? And I don't remember that. It really changes you. Some of those side effects go away pretty quick. Some can last a long time. So how do you stay positive? How do we stay motivated? How do we wake up every day and we keep going because we know we have to? You're just kind of maybe feel like you're floating through that day and you don't really have a plan, or how am I going to get back to this? So this is where we decide, how is your attitude going forward? How are we going to do it? How are we going to face this? How is this going to shape you? How has it changed your focus and maybe your mission and what you want to do in life? And only you can get to decide that. Your spouse can't talk you into how to do it. Your kids can't do it for you. You've got to decide, how are we going to do this? We've got to survive and thrive through this. All right, so now we're going to focus on you and taking care of yourself, mind and body. different things we've gotta do. We've gotta have a good balanced diet, regular exercise, maintaining that healthy weight, avoid smoking and excessive alcohol. Our food is so very important, and we have amazing nutritionists in our cancer center too, who are available if anybody ever wants to talk about that. But just good fruits, vegetables, whole grains, beans. We really got to focus on what are you putting in your body. It's so important. We need good fiber, nutrients, and phytochemicals. So what are these phytochemicals? So these are these nutrients that help, and they're just our regular foods, but there's a whole class of these. Strengthen your immune system, reduce our inflammation, preventing our DNA damage and help repair that DNA. They slow cancer cell growth, regulate hormones, prevent damaged cells from reproducing. So these are all super important things for us. Really limit your processed foods and red meat, sugary drinks for sure. All these things can lead to weight gain, which increases our cancer risk. The Mediterranean diet is supposed to be one of the best ones out there, so folks are kind of encouraged to try to adhere to that Mediterranean diet style. Lots of water. Exercise is huge, and it's hard to work that into your life, but we've got to do it. So 150 minutes a week, that's like 20-ish minutes a day. So we can do that. Or 75 minutes of more vigorous activity a week. At least 2 days of some strength training, especially for women, this is huge. Our bone health, we are losing our calcium and our estrogen drastically, and your bone health is crucial. So if you can get some strength activity of any kind, resistance, weights, any of that, it is huge, 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 especially for women. And just be consistent. Find something you enjoy. It can be going for a bike ride. It can be a YouTube class. It can be doing yoga. It can just anything that you enjoy, just get out there and do it. Obesity and being overweight really increase our risk for certain cancers. You gotta quit smoking or any kind of tobacco. That's just not even that's a non-starter. So we've gotta work on no tobacco whatsoever. Limit alcohol consumption. The more alcohol you drink, the higher the risk. So it's just associated with consumption quantity also. For some type of cancers, more notably breast cancer, even drinking a little bit can increase our risk. So alcohol's a huge one too. So mouth, throat, voice box, esophagus, liver, pancreas, colon, breast, stomach, everything's affected by alcohol. So just really be aware of, you're relaxing and you have a glass of wine every night. Well, that's probably not the answer to relaxing, and try not to associate alcohol with relax. Like do some yoga, do something different. So we gotta kind of change our association sometimes. Drinking and smoking together, astronomical rise in the mouth and oral cancers. Regular alcohol use really damages your liver, lots of scarring and inflammation in the liver cancer risk. And then 3 drinks a day can be stomach cancer risk. So just lots of things contribute to this. This new breast cancer data, which I think is pretty wild. So they say 3 drinks a week. I've seen 3 to 6 drinks a week is a 15% increase in your risk. And add 10% for every additional drink. So that's a lot. That's a big risk for breast cancer. This was I don't know if you guys saw this, but the Surgeon General put out some new data on alcohol and cancer risk. So it's the 3rd leading preventable cause of cancer in the U.S. 100,000 cancer cases with 20,000 deaths a year from alcohol-related cancer. So this is something we can control, and it doesn't matter what kind it is, beer, wine, liquor, whatever it is, increases that risk, and it's the amount, not the type. So a beer versus a glass of wine versus it just is the amount that you drink is really what adds to that. Just be super vigilant with everything else too. Your sun exposure, you would need to see your dermatologist every year. Stay on top of cancers. Melanoma is no joke. Really take care of your skin too, just all aspects of you. Follow with your healthcare team and your providers. And anything that's new or different, I want you guys getting checked out. Just really be on top of it. Different signs of recurrence. There's a lot of different things to look for with the cancer recurrence. So, and if this is like new onset, like you've had new nausea and vomiting, a new cough, new shortness of breath, fevers, seizures, fatigue, bone pain, a new mass, a new lump, new changes in your skin, redness, dimpling, thickness, any discharge from the cancer site, weight loss that you can't explain, appetite, dizziness, lightheadedness, any bowel or bladder function changes. So anything that's different, go get checked out. Maybe just fine, but I'd rather you get checked out and know that it's okay. Our mental health is huge, and I don't feel like this is talked about a whole lot. So this conference is amazing to really focus on mental health and well-being and how we take care of ourselves. So we all have great resources. So all your physicians, your nurses, your social workers, you've all got great resources for mental health. And you know, it's okay to see somebody. There's kind of a stigma there if I don't want to go see somebody because it, you know, it may look like a weakness, or it's okay to see a therapist, a counselor, a psychiatrist. We have a cancer-focused mental health provider at the Cancer Center who's amazing. So we have great resources for this too. We have a lot of support groups who are amazing. So I think it's invaluable to meet folks who have gone through what you've gone through. And you guys really have this whole different way to connect and understand each other and this, you know, this whole crazy journey that you've had to go through. And really engage in these activities that promote like your relaxation and well-being, exercise, meditation, restorative yoga. Go for a walk. Just take care of your mental wellness. You know, maybe we can't control the cancer, but we can control our healthy choices and managing our stress levels. So really please just be patient with yourself. I feel like folks think, well, by this time I should be fine, or I shouldn't be crying anymore at year 2, or I should feel like everything's okay, and it's okay not to be okay. Don't feel like you should be in this box of time where I should be okay. It's okay to feel how you feel. Be patient with yourself, give yourself time to heal. Never forget how amazing you are. All of you are amazing. People that have gone through cancer treatment and come out the other side, that's amazing. That's a huge deal. And you never gave up, and you're stronger than you know. You knew you had to keep going, not only for yourself, but for your family, and giving up's just not an option. So when you started this journey, you may have thought, how will I ever make it? How am I going to do this? And now here you are, and you've emerged from it, and you're changed forever, and you should never take a single day for granted. It's a couple of my favorite quotes that I came across. So cancer can touch you, but not your soul, neither your thoughts nor your heart. And you beat cancer by how you live, why you live, and the manner in which you live. So never forget how awesome